in sound of today.
Hey there, and welcome back to Tap the Art of Physiotherapy. I'm Joel Kryczka, sport physiotherapist. Today we're going to talk about nerve compression injuries. I see them a lot clinically, and I definitely see neck injuries in jiu-jitsu. I think it's more common to see some of the neck injuries than we are going to see with some of the low back nerve compression injuries, but honestly, I've seen them all. And I just want to discuss some of the most common ones. Again, when we look at nerve compression injuries, what that means is on the spectrum of an injury here, on one side, we've got muscle joint tendon type injuries, and on the other end of the spectrum, we've got a nerve being compressed. And when a nerve is compressed, essentially what we're looking for is impaired reflexes. Sometimes it will have constant numb tingling or pain shooting down the arm or leg. And the big one that's important is a loss of strength in a particular pattern. Now that pattern is absolutely important to diagnose clinically, but it's also good to understand as an athlete, like where are some of these other weird symptoms coming from? And in this case, it's coming from a compression of the peripheral nerve. So what I mean by that is if we have the spinal cord, that's just like the central nervous system, it's part of it. And then as it comes out of the spine here, that's where it becomes a peripheral nerve. And if that nerve coming out of the spine gets compromised in any way, in this particular case, we're talking about a compression. So whether it happens from a disc herniation, whether it happens from trauma, or stenosis, which can happen for old age, and in particular, some like the older grapplers, when their necks don't move as well, and then they get their neck torqued, that can cause a nerve compression. And as I said before, one of the key characteristics of a nerve compression that we have to look at is weakness in the periphery, so the arms or the legs. The most common nerve compressions that we see in the neck is C6 and C7. So if we're looking at the spine here, we're counting down from the top, 1 to 7, and the lowest one in the cervical spine that we see clinically is 7. So C7 and C6, the one up just from that. Now, I say those are important because what we end up seeing when a C6 nerve gets compressed is we start to see some patterns of weakness in the arm that you have to recognize. The first one, C6, is weakness in the bicep, weakness in the supinator, going palm down to palm up, as well as the wrist extender. Okay, and then if we look at C7, we start to see weakness in the tricep, the pronator, and the wrist flexor. So you can see that they're all opposing muscles. And in any injury in the upper extremity, if we have a weakness somewhere in the arm, it can influence other parts of the arm. So you could have a C7 nerve injury that's being compressed. It causes weakness in the tricep, weakness in the pronator, weakness in the wrist flexor, and it will influence and cause an injury to the wrist extenders because they're not getting co-contraction help. And so that's kind of what I mean is that even if we're looking at something like a wrist extender injury or a tennis elbow, and we have to clear the nerve first. So anytime we have an injury, you have to clear a nerve compression. And that's why I'm going over this, so that we can start to kind of understand that if I clear the nerve compression, then I can focus on it's not being compressed, the nerve's not irritated. Now I know I'm just dealing with a muscle joint tendon injury, okay? So then when we look at the lower extremity, the most common ones that we see coming out of the low back and down into the legs is L4 and L5. And that's again, right, I don't know if the camera can see this, but right at the very bottom here. And those ones are the most commonly injured because we see our spinal cord go from a straight up down position to a real curved right at the bottom. And so when we look at L2, 3, they're less likely to be injured because again, gravity is stacking pretty nicely on top of those. But as we get down to L4 and L5, it starts to curve into a downwards position. And again, that's when gravity compresses, and then we start to see a lot of issues at L4 and L5. And if we're looking at what muscles are impaired with L4, we start to look at ankle dorsiflexion and ankle inversion. So ankle up towards the head and ankle inversion or inwards towards the sole of the foot. And if we're looking at L5, we sort of see a very similar kind of thing as we look at the big toe extender, which is a weird one because you got to convince people you have to check their toe strength. And everyone says, well, I'm not strong in the toe. But the reason that we're looking at two different muscles, because the other one, L5, is an eversion, so pulling outwards towards the outside of the foot. And the reason that we try to have redundancy in the muscles that we're testing for here is that if someone, let's say that someone has an L5 nerve compression and we test their toe, but they have a toe injury. Well, we can't really use that as a reliable source for what's going on with the nerve compression. So we have to look at the secondary muscle supplied by that, which is the peroneals or the eversion of the ankle. And it gives you a really good idea of, is that nerve compressed or is it just a musculoskeletal weakness in that area? And so again, it helps with differential diagnosis, but also then helps with treatment. If someone comes in with an ankle injury and it turns out that they actually have a nerve compression that's causing weakness in the ankle, you can spend all the time in the world trying to rehab an ankle, but if the source is coming from the low back, you got to fix the back, okay? So when we are dealing with these nerve compressions, first off, it's important to properly diagnose. Where are they on the spectrum of this nerve injury? Is there a full compression that's causing weakness in the periphery and the ones that I've talked about in terms of C6 or C7 or L4 or L5? If it's not causing a weakness, is there an irritation down the arm when I stress that particular nerve? So the easiest one to kind of talk about is the sciatic nerve. If I have a nerve being irritated but it's not being compressed, the worst thing you could do for it is to try and stretch out your sciatic nerve or stretch your hamstring. And I've talked about this with hamstring injuries before, but you'll see people who irritate their sciatic nerve through a low back injury. They lose flexibility because the nerve is irritated and your hamstring tries to guard it. You'll see this very often, again, in like an over-under stack or something like that. But in other sports like yoga, dancing, they get a low back injury, they lose their flexibility and they all freak out and they try to reach and touch their toes because they don't want to lose their flexibility. But we can't do that anytime there's a nerve injury present because you are adding tension to something that's irritated. And if the nerve is compressed and causing weakness, not only are you stretching it, but you're actually, imagine you've got a compression on the nerve and then you're stretching it, you're actually tethering that compression along the nerve, irritating it even more. So the simple answer is, if you have any referred pain, plus or minus numb tingling, plus or minus weakness in the leg, it's really important, as I've said before, do not try to stretch your hamstrings, leaning forward to touch your toes. And in the next case, don't be, so if this is my right side that's injured, I don't want to be pulling my left ear to my left shoulder trying to stretch this out. There's a reason why your trap muscles are tight. They're trying to unload the nerve. There's a reason your hamstring muscles are tight. They're trying to unload the nerve. And if you keep continuing to stretch that out, it's going to keep irritating the nerve. And it's a little bit more complicated in the upper extremity because you really don't want to be doing a chest stretch either. You've got the nerves coming out of the neck, down into the brachial plexus, and into the sort of underarm area. And so if I'm stretching that out and my pec feels tight, again, maybe there's a reason that that pec muscle's tight to protect the nerve. When we have these nerve compressions, it's absolutely vital to restore range of motion of the neck or the low back, because typically there's going to be stiffness above and or below that area. So if I have an issue, say at C7, it's very common to see a stiffness through the neck joints above that, as well as the upper thoracic spine below that. And if I'm dealing with a low like a lumbar L4, L5 nerve compression, there's almost always an issue at the junction where the ribs join the low back, that thoracolumbar junction. It's almost like a traffic jam. And it's really important that you mobilize or manipulate those joints. If you're an athlete that is having difficulty getting past this nerve compression, it's really important to see a sport physio or a sport chiro that can manipulate the joints and make sure that you're not further torquing on the nerve. And lastly, it's really important that when we're trying to rehab from these nerve compression injuries, that we have to work on the strength and posture, as well as the strength of our hips. When we're talking the lower extremity, one of the major issues that you see with an L4 or an L5 nerve compression is that the hip muscles, the glute med and the rotator cuff, as I've sort of talked about in glute fundamentals, they're supplied by L4, L5, S1, and S2. And so those glute muscles don't get enough input and they start to get weaker. And so like if this is my spine and this is the pelvis, if my right hip gets weaker, every step I take, I'm either gonna lean my body over top because I don't have the strength to stay upright, or my pelvis is gonna drop. Either way, it creates a compression right at that L4-5 area. So it kind of tends to perpetuate itself. And that's why even though the glute muscles are only really getting input from 2 or 3 out of the 4 muscles, or 2 or 3 nerves rather, to the muscles, we have to rely on that redundancy to help strengthen the hips so that we don't further compress just with day-to-day activity. And in the shoulder girdles case, posture is absolutely critical. And this is where jiu-jitsu comes in handy. It's really important to think that if I'm in someone's guard, I'm gonna be up nice and tall, tuck my chin like a nice straight column. That type of posture is absolutely critical to unloading that nerve compression at that C6, C7 area. But we also need to make sure that we're not adding any downward force to the shoulder. So if you have any purses or bra straps or anything like that, you gotta really loosen them up to make sure that we're not having any downward force on that, okay? So again, when we think about nerve compression injuries, the big things are make sure you do a proper diagnosis to either rule in or rule out the most common ones, C6, C7, L4, L5. They have a distribution pattern that follows a very expected way of doing things, so that if I see a pattern of weakness in the arm and it doesn't follow what I'm expecting to see, perhaps it's that nerve compression. And again, to remember, C6 is bicep or elbow flexion, supination, and we're thinking about wrist extension as well. Okay, that's C6. C7 is tricep, pronators, and the wrist flexors. When we look at L4, we're thinking ankle dorsiflexion and ankle inversion. And if we're thinking L5, we're looking at big toe extension or ankle eversion. Make sure that we don't stretch the nerves. And as we start to heal up and things start to get stronger and we're having less sensations go down the arm, then we want to make sure that we add like a layer of armor to this by strengthening the hips and strengthening the shoulder girdle with excellent posture. Thank you. I hope you have a great day. I hope you've enjoyed. See you on the mat soon.
The in sound of today.